I would say that it's data. I think bringing together the phenotype and the genotype data offers an opportunity for personalised treatment and personalised prevention, which is unprecedented and where the NHS has a huge advantage over any other healthcare system in the world.
Without doubt, workforce. We know that for the numbers that are coming out of the nursing training colleges, coming out of the training programs for doctors and for physios and for OTs, that's our biggest challenge. We've got to be much more diverse in how we use staff, how we retain them, how we use them much more precisely to their own skills, and to take away those tasks that they don't need to do, that we can actually get electronic systems or other staff to do instead of those very skilled hands.
I think it's demand. I think we've got an ageing population, we've got lifestyle choices that are being made that are contributing to ill health. So I think the biggest challenge facing us is how do we kind of stem the tide of demand, and that's not just about hospital services, but it's how do we provide a much more integrated care and health offer for the communities we serve.
In one word, change. The reason I say change is every year we seem to be seeing more and more change, and we know that there's more change required, but we need to make sure those changes are the right changes. So the word change can be taken in many different ways, can't it? And for me, it's about taking a few steps back and truly understanding is what are the key things that do need to change to make a dramatic difference, and stop messing around the edges. Let's get the change right. It's getting it right first time.
In one word, I think the challenge that the NHS has got above all others is workforce. We know that we're under-doctored, under-nursed. We know the hospitals aren't able to open up new wards because they can't staff them. So many new technologies are coming along, new treatments, patients' needs are getting greater and greater. We just don't have the workforce. I went to a meeting with Jeremy Hunt before he stepped down, and there was a table of 20 leaders from different parts of the profession, and he said what was the biggest thing, and we all said workforce is the number one priority.
In one word, it would be staffing, I think, would be the first thing, because that's the challenge across the health service that we face. But I think for us, in my organisation, it's about that wider resource of how do we fund the latest technology? Where's our resource to help us build and deliver that in a healthcare setting? So I think resource is a wider global term that hooks into many things. I think it's the challenge we all face, and I see it from a clinical point of view in terms of how do we recruit enough nurses to be in the clinical area, and I see it from an informatics point of view that we're competing with Microsoft and IBM to recruit those bright young software developers, and we can't offer the same benefits.
Key word that I associate with the challenge in the NHS is the N in NHS, national. I say the thing that's held us back before is I don't think we're actually very national. But one thing that has happened with the Scan for Safety project is we've started to talk to each other much more effectively than what we ever have done. We're now sharing data, we're sharing resources, and we're coming together back towards the National Health Service.